a better point to start actually might be understanding what a neural pathway is.
Yes.
And really simply, it's the connection between our brain and any muscle in our body. In
Okay.
order for our muscle to move, there needs to be a connection from our brain to that muscle. That's
Yep.
the neural pathway. So I like to explain neuroplasticity as the ability of our brain to strengthen that pathway or find a new pathway, a different way to get from point A, which is our brain, to point B, which is our muscle. And I like to focus on neuroplasticity specifically through functional exercise
Okay.
and repetition.
Howdy, and thanks for learning about MS with me, Aaron Boster. Today I am thrilled to have Dr. Gretchen Hawley, a physical therapist and MS specialist, and a friend of the channel, join us. Dr. Hawley, thank you so much for being here.
Of course, thank you so much for having me.
To get us started, would you mind sharing with us sort of the journey that led to you creating your amazing presence online, the programs that you run, and really what inspired you to specialize in MS?
What inspired me to specialize in MS was my first experience treating with someone who had MS was a woman who was about the same age that I was at the time, which is 24, 25. And she had her biggest goal was to stand long enough so that she could go to a bar and order a drink standing at the bar with her friends.
Yeah,
And that to me was just like, oh my gosh, like that is something that so many people just take for granted and we
amen.
don't think about. And so hearing that first was like, okay, there's something to this where she's been to physical therapy before and it didn't help her. So
Yep.
my immediate thought was, there's got to be a different way. Like, how can we approach this differently so that you can reach this goal of standing longer? And then I had someone else around the same time diagnosed with MS, and they had completely different goals. They had a completely different MS journey, different
Mhm.
symptoms. And that just blew my intrigue up like 10 levels because I was like, okay, so MS is different for each person. And I love brainstorming. As a physical therapist, that's my favorite thing to do. And so with each person, I had to come up with a different plan. It wasn't cookie cutter.
Sure.
And shortly after, I realized that that was very rare and there's very few MS specific physical therapy resources. And so that's when I decided to go online and share my knowledge and education and expertise in other ways like my program, my podcast, YouTube, etc.
Well, the community thanks you because you're a gem and a resource. I want to pick your brain, and I thought we would start off talking about a topic which I know that we're both very enamored with. That's neuroplasticity. So, so when you think about neuroplasticity, how do you describe it to someone? What are your thoughts on how it works? And importantly, what kind of exercises do you help people utilize to optimize neuroplasticity or to facilitate neuroplasticity?
So, neuroplasticity, at least the way that I like to think of it, is it can do one of two things. It can strengthen our neural pathways
Hmm.
or find new neural pathways. And a better point to start actually might be understanding what a neural pathway is.
Yes.
And really simply, it's the connection between our brain and any muscle in our body. In
Okay.
order for our muscle to move, there needs to be a connection from our brain to that muscle. That's
Yep.
the neural pathway. So I like to explain neuroplasticity as the ability of our brain to strengthen that pathway or find a new pathway, a different way to get from point A, which is our brain, to point B, which is our muscle. And I like to focus on neuroplasticity specifically through functional exercise
Okay.
and repetition. So we know that from research, in order to get neuroplasticity to work, to strengthen or find those pathways, we need to repeat the movements that have the desired effect of moving our muscle, but in a functional way. So a lot of people might relate to this where maybe you are exercising, you're specifically doing a seated recumbent bicycle, and you
Yep.
get so strong, you're really exercising, you're cranking up the resistance, but you're still thinking, but I'm not walking any better.
Yeah.
A perfect reason for that is because the bike is only a functional exercise if your goal is to bike better. But biking often doesn't help with walking.
Yes.
Walking exercises help with walking. And so the way to activate neuroplasticity, one of several ways, is through functional exercise and high repetition of those exercises.
That's very well stated. Thank you for explaining that to us. I also wanted to talk about myths. There's a lot of myths about MS on the internet. There's also a lot of myths about MS and exercise. So I'd be curious, in your vast experience at this point, what are the most common myths related to MS and exercise that you run into?
One of the most common one is that exercise can make symptoms flare, but more times than not, exercises shouldn't make symptoms flare, especially if you're keeping your core temperature cool.
Hmm.
9 times out of 10, if symptoms are flaring due to exercise, it's just because your core temperature has risen by at least half of a degree or more and you
Yep.
have heat intolerance. So keeping yourself cool can almost always prevent exercise from flaring anything. So that's probably the biggest myth. Also, is that exercise will make me more fatigued,
Yes.
or I'm too fatigued to exercise. But when exercising in the right way, it can actually reduce fatigue and prevent fatigue from coming on in the first place.
Amen. I definitely hear the Dr. B, I'm too fatigued to start a program. How do you grapple with that when you're faced with someone saying, I'm so exhausted, I don't know how to even get started?
Yeah, that is such a common statement that I hear. And what I like to suggest is pick one exercise and do it one time per day. Maybe ten repetitions, but just once per day. Start that little. And if that even feels like too much, pick one exercise and only do 5 repetitions once a day. Start small. So often we think that exercise needs to mean 20 minutes, 30 minutes, an
Yep.
hour, all
Yep.
at once. And research shows that that is not true. You can exercise throughout the day, you can just do a little bit here and there. But when dealing with extreme fatigue, just pick one movement and it can be your favorite one. It doesn't have to be the one that's most challenging, but start there and then slowly over several weeks or months, start adding on once you're able to.
That makes so much sense to me. I think a lot of us, we think back to the glory days of high school when we had unbounding energy and we could exercise for hours after school each day. As I age, boy, I can't do that the way I used to. That makes
Right.
a lot of sense, kind of reframing how we think about it.
I think that so many of us grew up with, go big or go home mentality. It's like, do everything you can. And so now as adults, we think anything less than that doesn't count. But even just movement counts. For those people who are saying exercise makes me too fatigued, can you at least get up to go to the bathroom?
Yep.
That's exercise. It's standing up and sitting down and walking. Do you have stairs in your home? If you're doing them, that counts as exercise. Did you get dressed today?
Yeah.
That counts. Like movement counts. And I think remembering that and reminding ourselves that that is true can be really powerful.
Amen. I mean, folding laundry, putting it in a basket, putting it on the shelf, that's exercise, man.
Absolutely.
I'm excited to ask you your favorite exercises. If you were to list out for us maybe like the top five, what would be your go-to exercises when trying to help someone with MS?
You know, I actually do have a top 5, and these
Okay.
top 5 are for anyone with MS, which might sound a little broad, but these are the top 5 where whether your muscles are affected or not, if you're in a wheelchair or if you're still running marathons, these are the 5 that I would recommend because they are great at strengthening the neural pathways that MS tends to attack the most. So
Okay.
one is, do you want me to demonstrate or just
I
mention?
would love for you to demonstrate. That
Okay,
would be
let me
awesome.
back. So one of them is marching. So we want to strengthen our hip flexors. You can do
Okay.
this seated or standing. So it's just sitting and lift one leg up and down. If it's too hard, you can recline backwards. But
Okay.
what this exercise does is it helps when walking, it helps us lift our leg up. So you could also
Excellent.
do the standing version. So that's number 1. Number 2 is bending your knee. So you can do that from a seated position where you bend. And let me warn you, this is the most challenging exercise for 95% of my clients.
Okay.
So bend, and then the same thing on the other side. You can also practice that one standing, holding onto a mobility aid if you need, but bend. And that helps you bend your knee to take a step forward when you're walking.
Awesome.
The third one is ankle lifts. Let me back up a little further. So that's going to be practicing lifting your ankle and lowering down, and the same thing on the other side. If you have foot drop or drop foot, foot slap, this is going to be the number one of these five. That helps you with lifting your toes up so that you don't drag or scuff your foot. So those would be my top three. The fourth one would be a balance one, especially if you're looking to improve mobility and walking. And this is so underrated. But the first thing that we need to do to take a step forward is shift our weight onto this front leg. Okay. And oftentimes people don't even realize that that's an exercise. So my favorite balance exercise is shifting your weight forward and then back.
Okay.
The better you can do that, the better you'll be able to balance on that leg so that you have time to bring the other leg through.
Makes sense.
And then my last exercise that I like is what I call a cone tap. Now, it doesn't have to be a cone. It can just be a print on the ground. But you're going to stand with or without a mobility aid for safety, lift one leg, and tap the top of a cone, or tap the top of an olive oil bottle, the top of a Post-it note. The higher the thing, the harder it is, the lower, the easier. But I could pick just like a little spot on my carpet here, lift, tap, and down. This incorporates almost all of those four exercises. You have to bend your knee, lift your leg, get your toes up, and balance on one leg. So it's a quadruple whammy, but that's one of my top five as well.
That's phenomenal. And thank you for sharing that with us. I also really like the fact that you pointed out that you can sort of adapt. You can do a lot of those things seated. You can do them standing with an aid so that you're stable, or you could just do it kind of on your own. That's really, really adaptive. And I love the fact that you don't have to be in a fancy pants gym to do that stuff.
Not at all. And often the most functional exercises are the ones in your home. And just to take it a step further, a big component of our brain understanding that we not only want stronger muscles, but stronger muscles so that climbing stairs is easier,
yes,
or walking is easier. One of the best things that we can do is not just functional exercise, but exercising in a functional location,
sure,
which means instead of just practicing step-ups at the gym, practice climbing your own stairs in your own home.
Yeah.
That will train your brain to utilize that strength in that specific environment and that specific situation.
That's brilliant. And I think it speaks to the fact that there's not always massive carryover from one type of exercise to another. And so the more relevant you can make it to your life, probably the better it's going to help you.
Absolutely. And for those that do need to modify or adapt, I just want to let you know that seated exercises are amazing. They're not any less than standing exercises.
Mm-hmm.
If you're having a day where you can't stand or do standing exercises, that's totally fine. There's so many amazing seated exercises. Or when you are standing, you can use a mobility aid to help you stay balanced. There's no shame in that.
Sure.
I think we need to, understand that modifications are a good thing. The more you modify, generally speaking, the more repetitions you can do with good quality. And the more repetitions you do, the more opportunities you have for strengthening or finding those neural pathways.
Amen. That makes so much sense. Let's shift the discussion to rest and recovery. This is another one that I think sometimes people overlook too often, because I would submit that rest and recovery might be as important as the actual exercise. How do you help someone learn that balance and figure out when they need to adjust activity levels to have better recovery?
So a really easy rule of thumb to remember is that, generally speaking, it's okay to feel fatigued for about 2 hours after your exercise routine, assuming you're exercising all at once.
Sure.
Anything more than that, then that is likely a sign that you have overdone it.
Okay.
Especially if with MS, typically what that means is not only have you overdone it, but climbing upstairs to go to bed at night is hard. And we don't want that. If it's limiting you throughout your day, you overdid it in some way, shape, or form. So it's a lot of trial and error. If you are feeling like, oh my gosh, I overdid it, that was too much, there's a few things that you can do.
Okay.
First, just do less next time. If you exercised for 30 minutes, next time only do 25 or 20. Or if you did 10 exercises. Next time, maybe do 7 or 8, or only do one round of the exercise instead of two, or do all of it, like fewer repetitions, fewer sets, less time. And you're just tracking this entire time and seeing what was the
Hmm.
combination that worked best for you. So it does take a lot of effort and time and mindfulness to be aware of what you're doing.
Is it helpful if someone keeps like a journal or an exercise log so they can go back and sort of track that over time?
Absolutely. And typically, what I have my patients do with that is that once you have your log and you know, okay, this is what works for me, what you will likely also be able to piece together is this is what works for me on a day where I am just shot and I'm really fatigued. But this
Okay.
is what works for me on the days where I do have more effort and energy to put in. So you can actually come up with some tailored plans based on the variability that MS throws at you each day.
Smart. That's really a good takeaway. You and I both hate this four-letter word that starts with F, fall. And I spent a lot of time in clinic trying to help prevent falls. Here we're asking people to exercise as part of their lifestyle, and yet we want to set them up for success, not failure. And we certainly don't want people to tumble. What are some easy modifications or suggestions you have so that their home workout environment is safe?
So, I am a huge fan of exercising with a mobility aid. So, if you're
Okay.
someone who normally uses a mobility aid, you can exercise with it. Here's the kicker: if you're someone who doesn't normally use a mobility aid, you can exercise with a mobility aid. Just because you're using a mobility aid doesn't mean that you're going to start depending on it or that
Sure.
you'll need a more intense mobility aid down the road. The way to use a mobility aid for safety is to use it while you're exercising, but only use it as lightly as possible. I'll show you
Okay.
another
Okay.
demonstration of what that looks like.
Please.
So if you want to be using a rollator, just because that's what I have here for your exercise, always make sure the brakes are on. But instead of putting a ton of body weight through it, you
Okay.
want to make sure your body weight is mostly in your legs and that you're only using it as lightly as possible. So the exercise wouldn't necessarily look like this. For standing marching, it might look like this. So
Got it.
practicing using it for support so that you can do it well and with good quality, but not depending on it. That will help strengthen your muscles, but also tell your brain that you can stand without the use of this. You're not depending.
I like the idea that there's no shame in that game if you use a mobility device, particularly for balance. I think we need to keep that in mind so that we can be successful. That's a really good one. Thank you.
Of course. And if you are struggling with balance, again, seated exercises. There's so many great seated exercises that can strengthen your legs and your core and your upper body. When we think of exercise, often we think of standing and walking, running, treadmill, stairmaster, all standing things. But there's lots of exercises where maybe you're even on your couch or in bed, maybe lying down. So there's lots of variability.
Yeah, that makes a lot of sense. I would love it if you could share a bit about the programs that you've created. Transparently, I have many patients that work with you and benefit from your program. So, could you talk to us a little bit about what you've put together? Because I think it's amazing, and how people can find you.
Absolutely. So, because this MS specialty that I have is so rare, combined with physical therapy, I started my online program called The Missing Link. And it's essentially a one stop shop resource where, of course, there's tons of physical therapy based exercises and calendars that tell you what to do each day and an accountability group. But we also bring in, as you know, guest speakers and experts in the MS community, such as yourself. I think you've been in 3 times now. Um, so we bring in other experts so that my members, get to ask those experts their questions. So it's really a comprehensive program for someone looking to improve their mobility through exercise, but also through other avenues and accountability. So you can find that program as well as some of my other courses at my website, which is missinglink.com, MSING link.com.
And I'll put all of the information in the description section below so people can go down there and find it. And so prepare yourself because I hope that many of my viewers reach out to you. What would you like to provide as a parting gift as it relates to encouragement for people impacted by MS who are trying to figure out how to live their best life and need to incorporate exercise into it?
The one thing that I feel would make the biggest difference fastest would be for the person listening to think about their goals, their mobility based goals, and think about it in a way of your daily life. What are your goals in terms of what do you want to feel easier? Getting dressed, getting in and out of bed, getting in and out of your car, typical day to day
Yeah.
situations. And then from there, pick your top one, if there is one, if not, just pick one, and do that thing as an exercise. So, for example, if getting out of bed is hard, then you can practice standing up off of your bed, getting out of bed as an exercise. But if it's too challenging, make it easier. So maybe throw your pillow under your butt so that you're not sitting down as low. But doing the thing that's hard as an exercise and making it easier so that it's not as hard can result in huge strength gains and balance gains and making your daily activities feel easier. So that's where I would start. If someone's feeling like there's too much, I don't know what to do the thing that's hard.
I think that's super great advice. And I remember once we were talking and you recommended the idea of when you get up off the toilet, sit back down and do a couple reps. I mean, that's such a challenge for some people. And so you might as well like rep that out and get better at it.
Yeah. And if, doing exercises throughout the day is so valuable, not just for your muscles, but for your brain too. So if there is something that you're doing frequently, for a lot of people, it is going to the bathroom. Every time you go to the bathroom, maybe, as you just said, maybe you do stand up and sit down 2 extra times, or maybe you do the seated marching exercise I demonstrated just a few times, but start associating something that you do with an exercise, and then you're automatically getting more exercise in throughout the day.
That's awesome. As always, thank you so much for jumping on the channel and for sharing these amazing tips. I'm sure that the viewers are going to check out the missing link. I really appreciate your time today. And as always, for those of you that are listening, thank you for learning about MS with us. Make sure to click the subscribe button on both of our channels so that you can keep upping your game. Thank you again and have a great rest of your day.
Thanks for having me.